Hello, everyone, and welcome to today's webcast hosted by Clinical Directors Network. My name is Dina. For today's webcast, we are featuring Dr. Kelly Smith, who will be presenting on Guide to Improving Patient Safety in Primary Care Settings, Warm Handoff. Dr. Kelly Smith, Ph.D., is the Scientific Director of Quality and Safety Research at MedStar Health Research Institute and MedStar Institute for Quality and Safety. Her research focuses on identifying and overcoming lapses in patient safety and improving quality of patient care through innovation and collaboration. Notably, she is the leading investigator in patient partnerships in quality and safety research. Dr. Smith is the principal investigator of the AHRQ Guide to Improving Patient Safety in Primary Care Settings by engaging patients and families. Dr. Smith receives research funding from the Agency for Healthcare Research and Quality, National Institutes of Health, and the Association of American Medical Colleges. At any point during the session, please type your questions for Dr. Smith in the chat box on the bottom right-hand corner of the screen. You may have to click on the purple tab to pull out a white window. Click on the chat bubble icon after you pull up the window. The questions will be answered at the end. In addition, anyone who wishes to obtain CME credits for their attendance should stay on after the Q&A period, and a link will be posted for the assessment. And now I would like to give our time to Dr. Smith.
Thank you, Dina. This is Kelly Smith. We're here talking about the Guide to Improving Patient Safety in Primary Care Settings by Engaging Patients and Families. This is our fourth webinar in the series, and this is our fourth intervention as part of the guide, which is called Warm Handoff. We're very excited about this particular intervention as it really starts to bridge the gaps in communication within the practice and with patients and families engaged. I just wanted to make sure that it's noted that I have no conflicts of interest, and if you have any questions or concerns about any of the information, or if you have questions about the guide, please feel free to contact me, and my contact information is on the slides. The Clinical Directors Network is also able to give you copies of the slides after the meeting. So the objectives today are to review some of the threats to patient safety in primary care settings that we identified and some of the interventions that engage patients and families to improve patient safety. I'm also going to be describing the role and the value of the warm handoff strategy in improving patient safety within primary care settings, and identify strategies for implementing the warm handoff strategy in your practices. I also wanted to give you a brief update on the guide and our goals for the project. So in 2015, the Agency for Healthcare Research and Quality funded a contract through its Action 3 mechanism to develop a guide for improving patient safety in primary care settings by engaging patients and families. The goals of the guide are to create opportunities for meaningful engagement between primary care clinicians, which includes physicians, nurse practitioners, and maybe clinical nursing, as well as pharmacy, if your practice has that, as well as with patients and families and the populations that they serve, to promote improvements in patient safety, not just quality. The interventions as part of the guide should be based on evidence, should be easy for practices to adopt with minimal technical assistance, and should be geared to practices who have not had much experience with patient and family engagement. Our project team includes a diverse group of stakeholders, including experts in patient safety, primary care, human factors, patient and family engagement, and healthcare professional behavior change. We work closely with the leadership at the Agency for Healthcare Research and Quality in identifying the interventions and supporting improvements in patient safety. We had several key project deliverables, including an environmental scan, which is now available for review on the Agency for Healthcare Research and Quality project website. During the environmental scan, we conducted a scoping review of peer-reviewed and gray literature that looked at patient safety, primary care, and patient and family engagement. We also consulted with patients and family members and domain experts to identify key strategies for improving patient safety in primary care. We developed a series of 4 case studies of exemplar practices from around the country. Those case studies include open notes, highlighting the program of team-based care and how we can potentially integrate using a team-based approach to improve patient safety in primary care settings. Information on patient and family advisory committees and strategies that have a strong history within hospitals and health systems and expanding those into primary care, as well as a highlight of shared decision-making, looking at how to engage patients and families in decision-making can improve patient safety. From the environmental scan, we identified several threats to patient safety within the primary care settings and interventions to engage patients and family members in overcoming them. The key threats to patient safety that we identified were breakdowns in communication, challenges around medication management, including prescribing, filling, and adherence and to medication regimens by patients and families, and emerging evidence indicating breakdowns in diagnosis and treatment, as well as challenges to patient safety through the environment and the fragmentation of care. We also identified an emerging body of evidence around errors associated with opioid prescribing and use. Some of the promising interventions that were promoted by patients and family members and that emerged through the environmental scan included shared decision-making, patient and family advisory councils, different approaches to team-based care, medication management as a primary source of improving patient safety, family engagement in care, and different approaches to improving structured communication within the practice. Our model of patient and family engagement in primary care really looked at approaching it as a holistic process with the strategies at the center to engage patients and families and overall improving patient safety by engaging the patient and their family members, clinicians, as well as the practice staff within the primary care environment to improve safety, quality, and experience. The 4 interventions that were selected by a team of leading experts in the field, patients and families, as well as our partners at the Agency for Healthcare Research and Quality included Teach Back, Be Prepared to Be Engaged, Medication Management, and Warm Handoff. Today, we're going to talk a little bit more about Warm Handoff, and the other webinars are available through CDN and will be available coming up on the AHRQ website if you wanted to take a look at those as well. So what is the Warm Handoff strategy? The Warm Handoff strategy is a way to encourage bidirectional or tridirectional communication with patients, family members, and their care team. The Warm Handoff strategy is similar to the concept of bedside rounding on inpatient units. It moves conversations between members of the healthcare team from outside the exam room into the exam room to engage the patients and family members. A warm handoff is a verbal communication conducted between at least 2 members of the healthcare team during transitions of care in front of the patient and their family members if they're present. It's a safety check. It's bringing the principles of high reliability communication into the primary care exam room or exam setting. It provides an opportunity for patients and family members to validate and verify the information being shared just to make sure that everybody's on the same page. So you might be asking yourself, why should I use the warm handoff strategy? As we identified in our environmental scan, communication breakdowns are a key threat to patient safety. Patients and families are always present and have an invested interest in ensuring communication that is accurate, timely, and error-free. The warm handoff strategy would allow your patients and family members the opportunity to correct mistakes, to ask questions, and or validate information that's being shared about them. This will also help reduce communication breakdowns within the care team and between the care team members. You might want to use the warm handoff to increase patients' understanding of the diagnosis and plan of care, engaging all the members in the team-based care, including the patient and family, and validate and verify that information exchange. Warm handoff should be used at several key points within the care encounter. After rooming the patient, after a patient's exam, or any time during transition in care, such as with a scheduler, a lab technician, nursing educator, or other members of the care team. During implementation, you'll want to examine your own practice's experience of how many transitions of care does a patient or family member go through for each time they come in, and walk that through and identify the best opportunities for potential breakdowns in care or breakdowns in communication to occur, and then start to build your program planning for how you integrate warm handoff into your day-to-day processes. So getting started. Our approach to building the tools and the interventions or strategies as part of the Guide to Improving Patient Safety in Primary Care Settings was to use a paired tools model. And what that means is that if we have a tool or an approach or a technique for a clinician or practice staff member to use, that we also provide supporting work or tools or intervention strategies for the patients and families, and vice versa. That way, we provide both team members or both sets of team members an opportunity to engage and an opportunity to support one another's active implementation or active adoption of that strategy. When getting started, what we're recommending is to start with the Implementation Quick Start Guide. This is a quick 5-step process of making sure that you've identified your champion and get leadership buy-in on the approach. You develop your process for using warm handoff, and there are some supplementary materials that I'll talk about to help you examine your processes and examine all of those points of transition for patients and families. Training your team members is really important. It's a critical step and will help you lead to success. So we've provided some tools and techniques and approaches that can help you to train your members and make sure that everybody's on the same page with where warm handoff is going. Make sure that you introduce the warm handoff concept to patients and families. Maybe a little bit different than what they're expected or used to. So making sure that they understand why you're asking questions or why you're engaging them in this process is an important component. And as part of any good quality improvement strategy, you want to evaluate and refine your process. So the first step of implementation is leadership buy-in. You want to make sure that you identify a practice champion and get leadership buy-in early on in the process of implementation. This will help support the practice change effort. It's a key element to successful practice implementation and improvement efforts. During this stage, a practice champion should be identified. The individual will be facilitating the practice improvement effort in terms of the design and development stages, organize meetings, and will be the key individual to lead the change effort. You will also want to identify other members of the team to engage as representatives of the different key stakeholders. You may even want, this may include clinicians, practice staff, practice administrators, and if you really want to engage your patient and family community, you can engage them as part of your design and development team. This way, you'll develop a handful of patient practice champions, as well as ensuring the patient voice within the practice change efforts. The second step is to design the implementation. Once you've identified your champion and your champions identified the team to help design the processes, we developed the design guide for the warm handoff because what we've recognized is that the idea of a warm handoff is a little bit different. It's different than what you would normally do within your practice, and it may take some step-by-step guidance in order to identify the different opportunities for transitions within your practice and identify resources that you might have available for implementation. The design guide is a several-page document that walks you through different approaches that we've identified that have been successful in terms of warm handoff and integrating that into care, and helping you to identify where to start. Not necessarily at every single intervention point or every single process or transition point, but identifying those few opportunities to get started and get a little bit more comfortable with the warm handoff approach. You'll also want to orient your practice staff and train your staff in the implementation strategies of the warm handoff, what it is, why it's important. So we've provided several resources that are available on the AHRQ website about the warm handoff and how to engage your practice staff, your clinicians, as well as some video that we'll be walking through today. Thanks. In terms of resources to support implementation, as part of our guide development process, we worked with patients and family members as well as primary care practice staff in terms of what they would need to support doing a warm handoff in practice. One of the recommendations during our evaluation sessions were to build a checklist for staff that they would have to help support the adoption that includes key elements of the conversation between the clinician and the practice staff to have in front of the patient or family member, and to remind them to ask the patient questions and engage them in the process. So we have two different versions of a checklist. One is a quick pocket card that you can bring out as you're starting to orient yourself and get comfortable with the warm handoff solution. Or there's also a larger page checkoff if you have the ability to have that readily handy and you can check it off as you go. So we really did listen to the voice of the frontline team members who would be responsible for implementing this and trying to provide them with usable tools and strategies to help support adoption. We also have clinician and staff handouts for orienting clinicians as well as primary care practice staff to what a warm handoff is, how to conduct a warm handoff, and why it's important. Some of the key strategies like the checklist are also included on that to give them a visual aid to help support adoption. These handouts can be used as part of training and part of education and really support the overall practice implementation. Step 4 for this is to orient your patients. Your patients and family members are an important and key critical element for this particular intervention. The patient fact sheet or handout is available to help the practice inform patients and their family members as well as their caregivers about how to use the warm handoff strategy. Again, it is a little bit different than what they're expected, and it helps to lay out the expectations of the patient and or their family members to make sure that they're willing and ready to speak up, ask questions, and better understand the information that's being shared about them. It also helps to reinforce the need for the patients and their family members to engage in discussions about their care. The fifth step is really to evaluate and refine, continuing to look at opportunities to improve your local processes and practices for the warm handoff implementation, potentially to spread it to, after you started with a first 1 or 2 transitions, to spread that to other transitions within the practice, and to look at every implementation may be slightly different in what you're looking at to evaluate. Observations are really important. This is where you could potentially shadow a patient through their care encounter to see if people are doing the warm handoff, debriefing about the warm handoff strategy during your team meetings, talk to people about what's working, what may be not working, and really engage them in the solution process. How can we build something in the practice to sustainably improve and integrate warm handoff into what we do? You can also do things like simple counts. Just count the number of times that a clinician or a clinical team was able to do a warm handoff. And really, you can even talk to your patients and families about how they felt during that process to make sure that you are being very mindful about engaging patients and families in communication. So overall, you might be asking yourself, how can the AHRQ Guide to Patient and Family Engagement to Improve Patient Safety help your practice be successful? Part of the wonder of this particular intervention and this particular guide is that it's part of, it really links very well to some of the practice transformation efforts that are ongoing in healthcare today. One of those practice transformations is the Practice Transformation Network, Person and Family Engagement Dashboard metrics. And many of the AHRQ PFE guide strategies link directly to the different PFE dashboard metrics. These include shared decision-making, health literacy, medication management strategies, as well as supporting for patient and family voices within the practice. Warm handoff can really help you to engage your patients in communication, validation, and verification that can help you improve things like health literacy, patient activation, as well as supporting the patient and family voice. So getting started, what do you do and where do you go? We've got a simple 5-step process as part of every one of our strategies. You want to prepare by identifying your practice champion, assessing your readiness for making a change, and securing leadership support. You want to plan by reviewing the strategies that are on the AHRQ website. You want to design an implementation that is specific to your practice. So we've provided tools and techniques and approaches and suggestions about how to implement, but you really need to take a look at your own practice and adapt the different tools and techniques to best serve you and your patient. You may want to consider engaging patients in the planning process, and you'll also want to select your evaluation metrics, just to make sure that what you're doing is actually making a difference, and it gives you an opportunity to reevaluate yourself on a regular basis. You also want to educate, so inform your practice team members, inform your clinicians, and educate and train team members in their specific roles and responsibilities, and that includes educating and informing the patients. You want to inform and make sure that the patients are aware that you're doing something for patient safety, that this is the approach that you're using. It could be the warm handoff, it could be teach back, it could be multiple of the strategies, however you decide to further engage your patients and families. And then as you evaluate, you really want to recognize your team's efforts. Behavior change is hard. Change is hard at the practice level. So you want to celebrate your successes, identify areas for improvement, and you want to monitor your impact just to make sure that you are improving patient safety at your practice level. So now we're going to open up the field for questions.
Okay, thank you, Dr. Smith, for that great presentation. So we will transition to a time of Q&A. Marianne asked, in your experience, what is the best way to identify a process improvement team? What are some things that we should be looking for in identifying those individuals?
It's a great question, Marianne. I think that part of what you want to identify in a practice team is somebody that has the time and commitment to do it. You want to look at making sure you have a representation from the different clinical team members. So if you look at a warm handoff, for example, you want to look at the disruption, the potential disruption. So who is going to be impacted? And that could be your medical assistant or your care team coordinator. It could be your physician or nurse practitioner or your pharmacist, depending on who the clinical team member is that's engaged in that transition, as well as the patients and families for this particular one, because it is something quite new for a patient and family member to hear the information being shared about them in front of them and having the opportunity to speak up and validate that. You may also want to engage practice leadership as they can start to help you identify areas for improvement. They can also help you identify opportunities for evaluation. So really looking at the stakeholders and the people who are going to be using the intervention or strategy will help you to better tie your practice champions as well as your development team to that process.
Okay, thank you. And Amy asked, can you elaborate more on other mechanisms necessary to make people more aware of the warm handoff?
Sure. So Amy, what we would recommend is that there's probably a different level of awareness that is needed depending on where your process or your practice has decided which transition points within the patient and family encounter your practice has decided to focus on. For example, if you're looking at focusing on the transition from after the care experience with the clinician to the referral for another appointment, you'll want to make sure that you're engaging and informing really your entire staff in that process design and development process, informing patients and family members that this is something new that your practice is working on. You can use the handouts or the posters that we have identified for patients and families for that. You can also use the handouts for at your staff meetings. You can use them during formal trainings. It doesn't take very long to have that initial information session about we are going to be starting a warm handoff. You know, our plan is to develop and design the process over the next month, and we're looking for a go-live date in 6 weeks. In that period of time, these are all the things that we need to learn. The video, unfortunately, it didn't play well today, but there's a great video on the AHRQ website, on the project website, that is available to help orient and give people a visual of what a warm handoff could look like. And that was based on our team-based care case study for the project. We really use them as the exemplar practice who does a warm handoff in front of the patient and family, and how that can really help engage patients and families in the conversation and have them speak up, not just about the specific information being shared at that visit, but also encouraging them to speak up even after the visit.
Okay, and Jennifer asks, where are breakdowns in communication most likely to occur?
Well, everywhere. What we noticed in our environmental scan that was pretty much at every point of transition within a patient's care across the continuum of care from inpatient to ambulatory, and even within the primary care practice setting itself, there can be opportunities for breakdowns in communication. And that could be breakdowns in communication between team members, between the patient and each of the team members, as well as the referral process from the point of the initial referral to a referral to maybe a specialist, and from the specialist back, where the patient and family members are really sometimes the only conduit of information from maybe an ED visit back to the primary care. And so engaging patients and families and getting them to feel comfortable speaking up across the transition can really be started at the primary care visit with the warm handoff approach. But breakdowns in communication are very likely to occur at any point, any transition point within, and even within a primary care examination. The example that we have in the video is a patient who had been in the emergency department and were taking their medications incorrectly from a misunderstanding of written communication. So that is one potential, and then you can potentially use teachback to start to validate and verify the information and make sure that the entire care team is on the same page.
And then Jennifer had a follow-up question. She says, thank you. Are there certain areas of the continuum of care when compared to other parts where the breakdown of communication can lead to more adverse events?
It's a great question, Jennifer, and I can't think of any off the top of our head. In terms of the environmental scan, when we looked at communication breakdowns within the primary care setting, at any point they could result in an adverse event, and that adverse event can range in severity. We saw a lot of adverse events related to medications and medication errors. So in terms of the severity, and I think that we know about those a little bit more because they're reported on a more routine and regular basis. Ambulatory care adverse events are really underreported. So in terms of the field, it's a great opportunity for the field to do future research on exploring some of the mechanisms of breakdowns and really looking at strategies to enhance communication and reporting of events as well.
Great. Juan asked, would warm handoff be effective when offering a rapid HIV screening?
I think that that's a great opportunity to really engage patients and families, particularly in something that's could potentially be a high stress opportunity, a high stress situation for the patient, and to link that patient with the tester to make sure that you're encouraging them to get the test, to do the screening. I think that it has a lot of wins there, potentially opportunities to do teach back to make sure that the patient understands why you're offering it, and then to provide the linkage that this is something that's really important for you to have. So I think it would be a great opportunity to link to that screening.
Okay, thank you. Paul asked, what are some of the safety challenges for the care continuum for members of the care team?
So not quite sure what you're asking there. Could you maybe rephrase that? Our environmental scan really focused on the primary care setting, but we identified that fragmentation of care and fragmentation from the environment of care between different points of transition, one within the practice, another would be between inpatient and primary care, and then between the emergency department and emergency department visits and primary care, and circling back and closing those loops. But we did identify communication challenges that were sort of the home with primary care for the patient and family, but linked with many different components of the care continuum and the care community. I hope that answers that question. I'm not sure it does. But.
Okay, great. Thank you. So if anyone else has any questions, please type them into the chat box. Okay, looks like no one else has questions. So that's all the time we have for today. Just as a reminder, the recording to this presentation will be posted on cdnetwork.org. We will also be pasting the link to the CME evaluation in the chat box. Thank you again, Dr. Smith, and thank you everyone for joining us today.
Great. Thank you very much.